budgets. We all remember the reform of Dr. Barrett just a few years ago, and he was very proud that he could save about 1/3 of the budget, cut 1/3 of the health budget. Well, I think that what we are observing now is something that is related to those cuts. Another interesting aspect of this current crisis is the application of private sector managerial experience to the public sector, and particularly public health sector. So in other words, for several years now, we have private sector managerial approaches adopted to public sector. Sometimes it works, sometimes it doesn't work, and apparently it does not work in the public health sector, and it certainly didn't work in long-term care facilities. So we can learn lessons from it that perhaps private sector expertise is not something that is very useful for running public sector. But that requires, of course, a certain change in our ideological orientation, because for the last few decades, what's good for the private sector was good for the country. I think there may be some lessons drawn from that experience. Another aspect of the current crisis relates to globalization, solidarity, and supply chains. We've all observed serious shortages of most elementary equipment. We've seen, I've seen on television, nurses in the United States clad in black garbage bags because they didn't have anything better to put on. What it does mean is that the maintenance of strategic reserves by the countries involved was disregarded in favor of on-time deliveries with long supply chains. That works, again, that works in private sector for normal conditions, when you don't want to have large stocks of merchandise and you need on-time supply, on-time delivery. However, it obviously did not work when the crisis struck. And as one observer put it in a rather sarcastic way, the invisible hand of the market turned out to be a useless and even dangerous extremity. At the same time, there has been, I think, some kind of awakening that the citizen who has been transformed into a client, and I think the word client as a customer has become ubiquitous. We used to be students, we used to be passengers, now we're all customers. And if you notice, those of us who used to fly planes, you remember those times when planes used to fly, we heard customers of Air Canada, never passengers of Air Canada. And I think this is not an innocent change. It means that everyone has been converted into a customer, including the citizen. And the freedom of the citizen has become a freedom of a customer to choose between different kinds of merchandise in the store. I think that this crisis sheds some light on that transformation, and I think we have to rethink of this process of transformation of citizens into customers. Another issue which is very much related to it is the solidarity. No, solidarity was clearly absent first in the European Union. We saw that some countries prevented transfer of medical equipment to those countries that needed it most, namely Italy and Spain and France. And we also saw closer to our home how President Trump attempted to block deliveries of masks to Canada. So it shows that solidarity is really missing. And it's not only missing within trading blocs like the European Union, but also within countries. I think at one point, different states in the United States competed with each other in order to acquire more equipment. That shows not only a lack of preparedness and national preparedness for this kind of emergencies, but also, again, the same spirit of competition that pervades even situations of emergency, which we are in now. Another lesson of this pandemic has to do with the word essential. We have heard every day the concept of essential services, essential workers. Now, it has become very clear that those who are indeed essential are not treated as essential workers. They are paid minimum wage. They are not remunerated according to the importance of their service to society. This is something which became very clear because the poorly paid and poorly protected personnel left many long care facilities, and that's one of the reasons why you have such a high death rate in that population. The crisis had existed before. I mean, I have read articles without being an expert in public health. I've read articles in regular newspapers that these workers are underpaid, definitely not motivated. They're really at the bottom of the social prestige. And now when the crisis struck, we saw tragic consequences of that, with the rather unusual measure of bringing soldiers in to substitute for this missing personnel. The attempt to bring specialized doctors apparently hasn't panned very well, even though they were promised $250 an hour. It certainly is more economical and apparently more efficient to bring soldiers. So again, we see that economic stimulation here didn't work, but what did work is a centralized decision of the federal state. And now we get to another issue which many scholars have related to, and I perhaps will spend some time on it. It's the issue of the virus, COVID-19, being a great leveler. If you remember in the beginning of the crisis, we heard that we are all in the same boat. Whatever your income, whatever your orientation, we are all together in it. And indeed, we had some celebrities, even British Prime Minister and others who were infected with the virus. Because at that time, the infection largely happened to people who traveled. And people who travel usually are somewhat wealthier than people who don't. Then when we moved from the traveler's infection to community infection, something else happened. It's the poorer elements of society that became disproportionately affected. So the question whether COVID-19 is a great leveler or a great revealer has been answered that it is a great revealer of injustices and inequalities. Again, this is nothing new because health and wealth correlate, and they correlate particularly in countries where economic equality is very acute. Needless to say, our neighbor to the south is one of the leaders in terms of economic inequality of industrialized countries. And there we see that the life expectancy of the wealthy is about 10 years higher than that of less wealthy people. And indeed, as I was preparing for this talk, I found information about two neighboring, almost neighboring areas in the United States, Fairfax County, one of the richest counties in the United States, and West Virginia's McDowell County, one of the poorest. And they're about 500 kilometers between the two. It's Virginia and West Virginia. But the difference in life expectancy is immense. In Fairfax, the wealthy area, men have an average life expectancy of 82 years and women 85, which is about the same as in the social democratic Sweden. By contrast, the average male expectancy for males and females in McDowell County, in the poor area, is 64 and 73 years, which is about the same as in Iraq. And that tells you that inequality is not only between countries, but within countries. And we in Canada, of course, very proud that we have a universal health system. But here in Canada, according to the president of Canadian Medical Association, the effect of economic inequality on health is just as serious. What the president of the Canadian Medical Association said, I quote, "What is particularly worrisome for Canada's doctors is that in a nation as prosperous as Canada, the gap between the haves and have-nots appears to be widening. Those with the lowest incomes were more likely to report being diagnosed with a chronic condition, 41%, than those with a household income of 60,000 and more, which is 28%. So in other words, those who have chronic condition are poorer people. And here in Canada, we cannot say that they cannot afford to go to the doctor because it's free. But apparently other factors also play a role. Namely, can that person take a sick day? Can that person afford to take a sick day to go to the doctor? There may be also other social factors playing, but definitely the chronic condition is one of the determinants of the outcome of infection with the virus. And we have seen that people have been dying precisely affected by chronic conditions. In the United States, it's also a racial divide that became even clearer today than before, because the disproportionate number of African Americans have chronic condition, and as a result, they die of COVID-19. Now, what is inequality and what's the sources of inequality? Thomas Piketty, who became famous in the last few years thanks to his works on economic inequality in history, argues that inequality is neither economic nor technological, rather it's ideological and political. And that's why I talk about it and about the political aspects, because what he proposes as a result, a lesson that he draws from this crisis, is to revive the social state in the global north and to accelerate its development in the global south. This new social state would demand a fair tax system and create an international financial register that would enable it to bring in the largest and richest companies to that system, which in other words means that there should be an international system that would prevent tax evasion. This idea has been advanced by many people, including a former president of the European Bank for Development, Jacques Attali, and he used to be an advisor to President Mitterrand at one point. He said that we have an economic system which is globalized and political system which isn't. And therefore, companies and rich individuals can maneuver between states in order to derive maximum benefit, with the result that public services are eviscerated. And again, public health services as well. So what lessons can be learned from it? According to Piketty, to revive the social state, which has been in decline for the last 30 years. And if we don't do this, all kinds of unpleasant consequences may ensue, including desperate, disorganized violence. In the same sea we see in many countries, including many countries in Latin America, where it's dangerous just to walk in the street because you may be kidnapped, you may be robbed, and so on. So far, we're very far from it, but the tendency, I think we have to be aware that nothing is eternal, and if 48% of Canadians are living from paycheck to paycheck, it means that if something happens in this fragile system, there will be massive, massive social disturbances, even in among peaceful Canadians. In the United States, I think it's even more serious. Since the beginning of the pandemic, 26 million, or something now, I think it's 30 million Americans lose their jobs, but the billionaire class added $308 billion to its wealth. And I'm talking about US dollars. So and that resulted as well in the black and white wage gap in the United States, which is larger today than it was in 1979. So all the successes of that period of civil rights apparently have been wiped out. Now, in the 5 minutes, if I'm right, that I have at my disposal, a few words about the international affairs and about the place of Canada and all that. An article in the Irish Times I think a week ago, was titled, "We used to love the United States or hate the United States, but we never pitied the United States." Now the United States showed that it was totally unprepared for the crisis. We have seen some very strange kinds of behavior at the very top of political power in the United States. But what is more important is that the international expectation of American leadership, not to say dominance, have been frustrated. The United States did not take leading role in combating this virus crisis. And we have now a situation in which many people, including former Prime Minister of Australia and others, and the former chairman of the International Monetary Fund, they're all asking what kind of a system are we going to have if the American leadership is no longer there. And for Canada, it's a particularly acute question because Canada is more dependent on the United States than perhaps any other country. So will Canada stick with the US as it always done for the last century, or diversify to untraditional partners, to move away from American dominance to something which would be different? This is a political decision, and we see that there is a political divide already present in Canada between conservatives who picked up the anti-China rhetoric of our neighbors to the south and the Liberal Party, which still doesn't do it. So last point, very, very last point, is what is health? Is it human health only, or is it also environmental health? I think this, whatever the origin of this virus, and I cannot speculate about it, it's quite clear that there has been a very positive effect of this crisis on the environment. And we were reminded that humans are part of the environment. We are not something separate from the environment. So perhaps one of the lessons we may learn is that the health of nature and the health of human health are inseparable, and that may be translated into more serious changes in what we consider normal. So far, we are talking getting back to normal, but we have to redefine, in my opinion, what normality is and should be. Thank you very much.
That was excellent. Thank you very much. I'm going to unmute the people on the phones. I will leave people who are online muted. I'll just ask you to unmute yourself for your questions. Feel free to ask
Hello?
your questions.
Hello. Good afternoon, everybody. I'm happy seeing the faces. Hope you are all doing well. I listened to the presentation and I was really, really caught. I have almost the same idea, but in respect of Canada, please. Should Canada continue to tie to the apron of the US? Personally, I think this is the time for Canada to get off from the US and call their bluff completely, because they seem not prepared, especially with respect to the present man in the White House, who is not really knowledgeable and incompetent to lead that country. I think for the meantime, I will suggest Canada just look for allies from other parts of the country, of the world. Then secondly, yes, I think that's all. What do you think, sir?
Well, I hinted at the fact that Canada may consider diversifying its international environment and getting more independent from the United States.
Exactly.
In international affairs, it used to be like that. You remember Trudeau père, in fact, acted quite independently with respect to China, with respect to Cuba, with respect to Soviet Union. It's no longer the case. And people say that in today's globalization, it's very difficult to sever ties that have been established for many, many decades, and economic ties. Indeed, that's maybe more difficult, but Canadians have a particular expertise in that, because the current Deputy Prime Minister, Chrystia Freeland, and I think hundreds of Canadians who participated in the events in the Ukraine did succeed in helping, or rather making Ukraine separate from Russia and sever the ties that were no less important than they are now between Canada and the United States. So if that expertise is put to good use, well, perhaps, and there is a political will, perhaps something may happen. But again, it's a decision that has to be made by citizens rather than customers.
Thank you very much. Thank you.
I think David Graff from Ottawa has a question.
Yeah, thank you. And thank you for your talk, Professor Rabkin. You talked about these kind of different levels of problems that COVID has, one being this existential theoretical problem where you call it's the great reviewer, and how we're kind of having to challenge our economic system, our social systems, our institutions, as well as kind of like a more in-our-face problems with Canada deciding whether to go with US and follow them or to kind of build on new multilateral connections. I guess what I'm wondering is, where do you see the greatest friction for, I guess, the world going forward? Is it a challenge to our capitalist system that we use? Or is it on more of this as for Canada, for our tighter connections? Is the friction between this choice between the U.S. and I guess the rest of the world, or is it a larger question of our economic security and capitalism, just challenging that system in particular?
Well, I think that it's definitely not a matter of the person who is sitting in the White House, because that person was not parachuted from the moon. The person was elected, and so he represents a very important body of opinion in the United States and around the world. So this has to be understood, that it's not a temporary issue. As to the nature of capitalism, I think, again, there's capitalism. I mentioned two countries today, except Canada, Sweden and the United States, and they both have capitalist systems, but they're very different. So I think that during the Cold War, and what in French they call the Trente Glorieuses, the years of welfare state, the capitalist system adjusted to the challenge of the adversary, of the socialist system, that was touting free medical care, free education, social rights, and so on. And in fact, the welfare state responded to that, responded actually well before the emergence of the Soviet Union or the Cold War. I just want to remind you that the first to introduce medical insurance in Europe was Bismarck, hardly a socialist, but he wanted to defang socialist attraction, and he introduced those measures. So I think that somehow, and I don't know how, we have to get back to the welfare state. One of the arguments we hear is that the state is doesn't have the resources anymore. Well, again, it's a political decision, ideological decision, as Piketty would put it, whether we want to have higher taxes or lower taxes, whether we can put an end to tax evasion of the wealthy or not. It's a matter of decision-making, a matter of ideology. If we believe that the invisible hand is going to take care of everything, well, it's a belief that has been shattered by this crisis, but some people may continue having it. So it's within, as citizens, it's within our purview to formulate solutions and to propose them in the public forum.
Professor, Jim Fairs here from Westmount. Never mind the politics and the different kinds of governments around the world. All things being perfect, do you think that the Earth globally has the wherewithal to create a welfare state for everybody?
Again, in my opinion, yes, there is enough wealth to create a welfare state, or at least decent conditions of existence. I think one of the words that was often mentioned with respect to the deaths in long care facilities here in Montreal was decency. There was no decency factored in the economic decisions of how to run those institutions, decency of dignity of the people who were their patients. So I think that there is a more just distribution of resources would enable to ensure more decent existence for people. I don't mean that people will become totally equal, but there is societism, and we have seen this process. I referred to it several times today, that in the last 40 years, in the absence of competition from an adversary system, we've had a massive transfer of wealth from the public sector to the private sector. I would like to remind you that the maximum tax rate in the United States under a Republican president, a former General Eisenhower, was 92%. We're no nowhere close to that number today. I think it's about 38 or 35. So I think redistribution, a wise redistribution, can save us from a lot of violence, because I think the alternative to doing nothing would be, or rather the consequence of doing nothing would be dispersed, disorganized violence on international level, but also within countries, within wealthy countries, in fact.
Thank you. Anybody else want to step in?
Yeah, sir, I have a follow-up. Thank you, Professor Rabkin. You're talking about this wise redistribution. And I'll give Canada certainly more credit than the United States. But where do you see, like, with the will, like you talk about this, like, do you believe that there's this willpower, into which I hope that there is, for this wise redistribution? And do you see it as just a matter of voting in the quote unquote right people? Or is it a larger advocacy and a larger, like a social movement, so to speak, to having that change, and whatever that might look like in the COVID era?
Yeah, I think it takes a social movement, because we have seen that elections have not produced expected results in many countries, and one of them is Greece, where they voted 3 times for a party that was supposed to stand up to the wealthy countries of the European Union, and that party totally did not do that, and did the very opposite for what it was elected. So I think that a large and a structured social movement may bring about those changes, because otherwise, you remember, I began with a quote from Citizen Kane. It's better than people with money and property take care of the underprivileged, because there may be people without money and privilege, and that would be a very unpleasant experience, which we've had a lot in the 20th century.
Thank you.
Lots of things to consider. Thank you very much, Professor Rabkin, for all that. I don't know if there's any other questions. If people can reach out to you offline, is that a possibility?
Certainly. Well, my email is available on the website of the University of Montreal, so it's very easy to find me.
To find you, perfect. So thank you very much.
And thank you for having me. It has been a pleasure.